Hey there, thanks for joining me. If you're here, it's probably because you're worried about your cat. And I get it. When our pets are sick, it's incredibly stressful, and it is completely normal to feel concerned when you know something just isn't right.
So, does this sound familiar? Maybe you're cleaning up messes way more often than you used to. It's not just the odd hairball anymore. It feels like it's becoming a regular thing. Or maybe you've noticed your cat is losing weight, even if they seem to be eating just fine. Or perhaps they're dealing with diarrhea that just won't quit. Yeah, those signs are definitely worth paying attention to.
And that's when the worry really kicks in, isn't it? Your mind starts racing. You see that your little buddy isn't themselves, and all you want in the world is to figure out what's going on and how you can make them feel better. It's the question every single one of us asks.
Well, that's exactly what we're going to do right now. My goal is to give you some clear, straightforward information about one of the most common reasons for these symptoms, a condition called inflammatory bowel disease, or IBD. By the end of this, you're going to have a much clearer picture of what it is and what the path forward really looks like.
Okay, so let's jump right in. The name inflammatory bowel disease can sound pretty intimidating, I know, but let's demystify it together.
So what on earth does that actually mean? Well, IBD isn't really a single disease. It's more of a syndrome. What happens is the body's emergency responders, these little inflammatory cells, start flooding the walls of your cat's stomach and intestines. This nonstop inflammation causes the gut lining to thicken up, and that makes it really, really hard for your cat to digest their food and absorb all the good nutrients they need.
Here's a great way to think about it. Imagine your cat's gut has a super sensitive security system. Now, a normal system knows the difference between good guys, like food and healthy bacteria, and actual threats. But with IBD, that system gets confused. It starts seeing harmless things as dangerous invaders and launches this huge inflammatory attack that actually ends up causing all the problems.
So you might be wondering, can any cat get IBD? And the short answer is yes. We definitely see it most often in middle-aged and older cats, but honestly, it can be diagnosed at any age, even in young kittens. There's also some reason to believe genetics play a part, as it seems to pop up more frequently in certain purebred cats.
Now, your cat can't come over and tell you what's wrong, but they are constantly giving you clues. Learning to spot them is one of the best things you can do. So, let's talk about the specific signs you might be seeing at home.
Okay, the number one sign by a landslide is chronic vomiting. And I want to be crystal clear about this. It is not normal for a cat to vomit hairballs more than once a month. If it's happening more than that, it's an early sign something's up. Other huge clues are diarrhea and weight loss. Even if your cat has a great appetite, sometimes they're even starving all the time. You might also just notice they're more tired, their coat looks a little messy, you hear some gurgling in their belly, or maybe you even see a bit of blood in their stool. These signs can come and go, but with IBD, they usually get more frequent over time.
If you're seeing those signs, the next step is definitely a trip to the vet. And knowing what to expect can make that whole process a lot less scary for you and for your cat.
Diagnosing IBD is really a process of elimination. It's like being a detective. First, we're going to have a good chat about your cat's history and do a thorough physical exam. Next, we'll run tests like blood work and check a stool sample to rule out all the other common culprits, things like parasites or kidney disease. An abdominal ultrasound is also an incredibly helpful tool. It lets us see if the intestinal walls are thickened, which is a big red flag for IBD. But, and this is really important, the only way to get a 100% confirmed definitive diagnosis of IBD is to get a tiny little tissue sample, a biopsy, from the intestine and look at it under a microscope.
Getting that diagnosis can actually be a huge relief because it means we finally have a target. We can stop asking what's wrong and start focusing on how do we manage this. So let's look at what that path forward looks like.
Treating IBD isn't about finding one magic pill. It's a team effort that relies on three key pillars. Diet is the absolute foundation. It's about half the battle right there. Then we bring in medications to help control that inflammation. And finally, we use other supportive therapies like supplements to help heal and address any nutritional gaps.
So let's break that down. We almost always kick things off with a strict diet trial. This usually means a food with a novel protein, one your cat has never had before, like rabbit or duck, or a special hydrolyzed diet where proteins are broken down so tiny the immune system doesn't even see them. If diet alone isn't cutting it, we'll add in medication, most often a corticosteroid like prednisolone to calm down that overactive immune system. A lot of cats with IBD also have a really hard time absorbing vitamin B12, so giving them regular injections can be a total game changer. And in some cases, we might use an antibiotic like metronidazole to help get the good gut bacteria back in balance.
So, after all of this,
what does the future actually look like for a cat with IBD? I really want to end this on a hopeful and very positive note.
This is probably the most important thing I can tell you today. While it's true that dealing with a chronic condition can be tough, the outlook for most cats with IBD is excellent. This is not a terminal diagnosis. It is a manageable condition.
So if you take one thing away from our chat, let it be this. We may not be able to cure IBD, but we can absolutely get it under control. Success is all about a partnership between you and your vet team. With a little patience, consistency, and the right game plan, your cat can feel good again and get back to living a full, comfortable, and very happy life with you.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.